Okay, so we've got a few more questions in just a few more minutes. So a community member's really concerned about the level of education that positive patients are receiving. They're just told to go home, quarantine. So is Kaweah Delta, have these issues been talked about amongst the medical community at Kaweah Delta? Because people are afraid, they don't understand how to treat symptoms, they're sick, they're lonely, depressed. So do we talk about how to educate our positive patients?
It's an excellent question, because I'd say the short answer is no. I mean, certainly if you're hospitalized, we're doing everything for you. We're hydrating you. We're giving you the medications. We're taking care of you. But if you didn't require hospitalization but you needed to quarantine at home, I've not read really any information about that. All the information that's out there is all about the things you should do to prevent contracting the virus. Washing your hands, wearing a mask, everything like that. But obviously there's a lot of people that have contracted the virus and they're quarantining at home. So I talked to Carrie Noeski, who's our chief nursing officer, to get kind of her thoughts, and we both agreed, and so we're going to take this opportunity to do more of that, to do some education and provide that feedback. There are resources available. If folks don't, we'd always say, speak to your physician if you have one and ask them, what are the things I should be doing? But a lot of, patients don't have a physician, or that physician's not accessible. Definitely you can call that hotline. Again, that's 624-4110. Even if you've tested positive and you're at home quarantining and you want to talk to a provider, they'll do a telehealth visit right there with you. We also have telehealth mental health services available. So those folks that are suffering that loneliness, that depression, which I fully understand that. So we have those services available that we can do by telehealth means, so that they can stay quarantined at home. Definitely we tell people, as with any time you're ill, if you have the flu or you have a cold, we tell people stay well hydrated, take care of yourself, eat healthy food, walk around in your house. Don't be, don't sit down, and because I know people are concerned about blood clots forming or developing pneumonia. And yeah, if one of your symptoms has been shortness of breath, you need to kind of take some deep breaths. You need to do some coughing, even if that's painful, and the person's right, because you don't want to contract pneumonia. Try, don't spend so much time lying down, so especially lying down on your back. So you need to, especially if your symptoms are those respiratory symptoms, you need to get up and move around, and ideally you need to spend some time on your stomach. So one of the things that we do for patients that are intubated is we prone them. It's something that's been found to be quite effective in helping intubated patients, as we turn them onto their stomach to help them with breathing. So again, hydration, healthy eating, staying somewhat active as much as you can, and talk to your physician, call our hotline if you don't have a physician, but we will work on putting information and resources out there. It's a great question.
Thank you, and that's great that you guys are working on that.